Hey everyone, it's Dr. Erica Person and welcome to an episode of the Flex Audiology Show. Today we're going to talk about how to get rid of that ringing in my ears, what is actually working in 2025. So full transparency, I have had tinnitus about 3 to 4 years now, and it's one of the most common questions that I get when patients come in to get their hearing tested is, how do I get rid of this ringing? And I get it. Tinnitus can drive you up the wall. It can get so loud. It can be distracting. It can cause anxiety. And the good news is that this year, we know a lot more about what is actually helping, what's not helping, what's causing it. And spoiler alert, there is no magic pill. We should all know that by now, but there are some real proven strategies that we can help to quiet that noise and take your life back. So that's what we're going to do. We're going to jump right in. And if you guys like this content, please make sure to hit that subscribe button. That really helps us grow our channel. So number one is, let's look at the whole picture here. Tinnitus is not a standalone condition. It is a symptom of something. It is your body's signal telling you something is out of whack. You need to stop and pay attention to what's going on. And so the very first step is always, let's get your hearing evaluated, okay? When you come in for a comprehensive tinnitus evaluation, you specifically want to ask for a tinnitus evaluation. Never just say, hey, I want to get my hearing tested. Specifically tell them, my main issue is ringing in the ears. I want to get my tinnitus evaluated. We're going to look at your hearing, your lifestyle. We're going to do a very thorough review of your health history, your medications, and that's going to include your cardiovascular health. Because, here's the truth. For some people, it's not their ears that are actually causing the problem. It's just how their body and their brain are reacting to stress or poor sleep habits, or even for many people, it's blood pressure changes. So we're definitely going to want to monitor and take a look at that. So let's just start with the basics. Let's look at your lifestyle and things that matter there. So generally speaking, sleep. We need sleep. People really underestimate the power of a good night's sleep. And for some patients, they think that they're sleeping well, but they may have underlying issues like sleep apnea. And so really their body is fatigued, it's sleep deprived, and that can contribute to tinnitus or even make it worse, make it louder. And then just simple stress. It's kind of stressful. The world's stressful. And high stress equals high tinnitus awareness, because everything's going on and then you've got this sound that's overwhelming in your ears, and your body literally turns up the signal, makes it louder. And so we got to really look at what can we do to decrease the amount of stress in our life. And then of course we want to look at exercise and diet. Everything seems to go back to that, right? But we're looking at improving blood flow to your ears and reducing the inflammation in your auditory system. Because if it is something in your auditory system, we want to help solve that problem. We want to treat that problem. Now, none of these are quick fixes. It doesn't happen overnight, but together, if we take a collaborative approach, we know we can lower that kind of background noise in your brain. And then medication review. I brought that up at the beginning. So medication is one of the biggest overlooked things. And when I say medications, most people are thinking prescription or something I got on. And that's not always the case. A lot of times it is, but sometimes it can be as simple as what supplements that you're taking. There are some supplements that make tinnitus worse. There are some supplements that make it better because it was a lack of that vitamin that your body was searching for. And once you give that vitamin back, things get better. So we're going to take a quick look at those. And to be super, super clear, I am not advocating for you to stop taking your prescription medications. That's a no-no. What we want to do is look at, can we identify a specific medication that is causing the tinnitus? And then we can work with your primary care physician to see if maybe there are alternatives to help, again, lower that sound in your ears. And then of course, we can't overlook the power of just simple hearing loss and damage to your auditory system. Almost 80% of all tinnitus patients have some degree of hearing loss. However, only about 20-30% of people with hearing loss have tinnitus. So It's not a one-to-one apples. And when the brain stops getting a clear signal, it will try to fill in the blank on its own, and it will amplify that ringing, that buzzing, that hissing, that humming, whatever it is that your brain feels like it's missing. It's just going to peak it and make it very loud. And so that's why for many people, when they do treat their hearing loss with hearing aids, that can dramatically reduce tinnitus perceptions. Now, many of the modern day hearing aids, they do have a built-in sound therapy program that we can utilize to help retrain the brain to tune that noise out. And then there's other sound therapy options. So things I'm thinking of would be something called linear or something called neuromonics. Other audiologists I know use different tools, and that's okay. So we're really not looking at masking the tinnitus anymore. We're retraining your brain how it reacts to it. So some of it could be gentle background sounds to more personalized soundscapes. Some of the theories is the goal is to train the brain to realize that the sound that you're hearing in your ears, it is not an issue. It is non-threatening, and your brain will taper it down on its own. So these types of sound therapies, usually they are separate from hearing devices. I get a lot of patients that come in here, they have normal hearing, their auditory system's fine, but they are still looking for treatment for their tinnitus. And so we have these other devices that are available to provide that sound therapy for you. And again, the goal is to reduce the brain's threat to the response of the ringing so that the ringing becomes neutral and it will fade into the background. And then, of course, most of these are paired with what we call cognitive behavioral therapy. And so that is really a nice holistic approach to treating the tinnitus itself. CBT, it helps rewire your emotional reaction to it. So again, the signal needs to be a non-threatening signal so that the brain will naturally habituate the sound itself. And CBT helps do that through education, through relaxation techniques, kind of training you to get through different activities and coping mechanisms when the tinnitus becomes overwhelming at times. And typically once that fear and that frustration of what's causing this tinnitus goes away, that tinnitus, it loses its grip. Once it becomes non-threatening and your limbic system, your emotional reaction to it tapers down, that is when patients will see an improvement generally in their overall health. Improved sleep, less stress, less awareness of the sound. It all works together. So what is actually working in 2025? It's a combination approach. We don't want to just look at one thing. And so a quick review, we're going to look at your lifestyle, your medications, treatment of hearing loss if we need to. If you don't have hearing loss, we're going to look at targeted sound therapies. And then we like to utilize CBT tools in the clinic as well. And again, it's not about silencing the sound. It's about silencing the power that the sound has over you. It's reducing the emotional reaction that we have to the tinnitus. So where do you start? You need to find an audiologist who specializes in tinnitus. A great resource is the American Tinnitus Association. They have a website. They have a list of providers on there. And you can even look for different things. So maybe ringing's not your issue, but sound sensitivity, that could be your issue that you're wanting to get treated. So the ATA website breaks that down. Of course, if you're in Dearborn County or Hamilton County in Ohio, you are more than welcome to come to Flex Audiology and we will help you out. Just remember when you're calling, specifically tell them you're coming in for a tinnitus evaluation because that's an entirely different appointment. And I would encourage that same awareness when you call any other practice. So if you guys have any questions about specific things, drop me a line, shoot me a message, and I'd be happy to help out.